I want to begin today by speaking about just the number of tests that were done in the last 24 hours, because it's worth noting. I don't think Dr. Ezike got to announce this number, and it was 29,266 tests. And although some of those are tests that were not reported in a prior day, the over 20,000 of those were performed in the last 24 hours. So we're very pleased with the progress that we're making on testing. Throughout this pandemic, I've said, and Illinoisans know, that the battle against the virus has been fought on two fronts: that of public health, of course, and to preserve the economy. The damage that this virus has done to jobs and businesses has really been devastating. National projections show some industries will begin recovering in the reasonably near future, and still others may take longer. Meanwhile, workers and their families are hurting. Federal relief has helped in the short run, and the state's support systems have provided a safety net to address the immediate financial pain. From early on, my administration has worked to support our residents and small businesses by banning residential evictions, by providing help to pay rent and utilities, delaying tax filing deadlines, expanding unemployment eligibility, and instituting loan and grant programs to support small business owners. But that isn't enough. We must do more. The legislature must convene so that we can begin to put our financial and economic house back in order, even as we battle this terrible virus. The General Assembly needs to pass a comprehensive plan to support families, small businesses, and small towns. The Congress is looking at supporting the states, and we need to make sure that we are supporting the people who make our economy go. In addition to significantly increasing rent assistance for families and working with banks on mortgage forbearance, we need rent and mortgage assistance for small businesses too. We ought to provide grants and loans for businesses starting and restarting, and tax credits for small business job recovery. Industries and businesses left out of the federal PPP should be first in line. And we must pass a law to distribute funds to small cities and towns to support their need to fund first responders and basic services that could fall apart from COVID-related revenue losses. As we work to keep our residents safe and gradually reopen businesses, I hope the legislature will act expeditiously to support jobs and economic recovery. Until then, I will continue to implement programs that are within the purview of my role as governor. To that end, today I'm announcing a program to provide $25 million in DCEO grants to help local governments jumpstart public infrastructure projects for the summer construction season. These grants are part of a $50 million program through Rebuild Illinois that we're expediting to help cover local projects that may have otherwise been canceled due to revenue loss related to COVID-19. This will keep key public infrastructure projects in the pipeline and will support the return of skilled labor to job sites for the busy summer season. Starting today, local governments with shovel-ready projects, including school districts, townships, and other entities, can apply for this funding. For those that need more time, the additional $25 million will be available through June 30th. I encourage representatives from any community in the state to contact DCEO for assistance. Funding will be prioritized to underserved areas and projects located in opportunity zones, though all communities are eligible. DCEO will begin to host webinars this week to assist local governments in the application process. Information on sign up is available and will be available on the DCEO website. As a reminder, more than $90 million was made available to small businesses through DCEO in response to COVID-19. Our $14 million in emergency hospitality grant funding was distributed to 700 businesses across more than 270 cities and towns in Illinois, providing help to restaurants, bars, and hotels to keep up with operational costs during this immensely challenging time. And DCEO is still offering tens of millions of dollars through two additional sources of support for our residents: our Emergency Small Business Loans Program and our Downstate Small Business Stabilization Fund. These programs can be found online at coronavirus.illinois.gov or on DCEO's website. I also want to highlight a new source of financial support out of the Illinois Department of Healthcare and Family Services to help our hospital systems, many of which are facing a shortfall in revenues due to their need to provide capacity for the potential influx of COVID-19 cases. This hospital stability payment program runs through the end of June, and HFS has already begun the distribution of $75 million to hospitals across the state of Illinois. The last 2 months have made exceptionally clear how critically important strengthening our hospital system is for communities across Illinois, not just in times of emergency, but as a continuous source of medical support for our residents, as an employer, and as a way to put an end to long-standing disparities in healthcare access and delivery. Our healthcare providers are seeing us through this fight against COVID-19, and I'm committed to ensuring their long-term survival and success in every way that I can.